In 1993, an international group of health researchers, providers and consumers gathered in Oxford in the UK to organise a collaborative approach to improve healthcare research and practice.
We left people in no doubt at all that if this was going to be done, it needed international collaboration. We demonstrated with the model of the perinatal work that it was possible to do it. We needed to get in touch with all of our allies around the world and to say, are you up for this?
They were motivated by principles set forward by Archie Cochrane that highlighted using reliable evidence that has been systematically evaluated.
He asked the question, how can we have a rational health service if we don't know which of the things being done within it are useful and which are useless or possibly even harmful?
Over the decades that followed, this international network of collaborators would improve and evolve methods of meta-analysis to systematically gather and review randomized controlled trials with the goal of synthesizing the best evidence for health outcomes.
It was actually all about, only using interventions when they were effective, and it proved that a lot of the routine interventions that had been around before actually just didn't work or had adverse effects, and so they eventually were stopped. Routine shaves, routine enema, routine episiotomy, they're all gone now.
The Cochrane logo is an example of one systematic review that demonstrated a benefit of treatment, in this case, corticosteroids, saving the lives of premature infants, including George Selby.
I think of hope.
Oh, bless you.
Why hope?
Because it gives me hope for the future that comes.
Cochrane is now an independent international network with members and supporters from more than 190 countries.
We made it a very clear goal that we would prioritize the conditions that are important to Africa. We have together been able to substantially increase the number of reviews that are relevant to Africa.
Cochrane review groups have produced over 16,000 new and updated Cochrane reviews over a wide range of disciplines. These have led to health policy changes that have saved and improved lives around the world.
When I go to international meetings on obstetrics and gynecology, without a doubt, people are quoting Cochrane reviews probably in every presentation on evidence or what's best practice or guidelines.
Today, a majority of World Health Organization guidelines are informed by evidence from Cochrane reviews.
The collaboration with Cochrane is very important for WHO, and this is why we value this partnership. Cochrane is one of the major institutions at the global level in particular to synthesize, to analyze and to disseminate evidence so that this evidence can be used by WHO in the guideline process.
Fundamentalmente ha transformado el panorama del uso de la investigación, estableciendo un puente entre los trazadores de políticas y las personas que tienen que tomar decisiones en salud, bien sea como pacientes, como trazadores de políticas, como prestadores de salud. Lo ha transformado porque estableció ese puente, ese vínculo entre el conocimiento científico y las decisiones.
On Wikipedia, the most referenced health journal is the Cochrane database of systematic reviews.
One of the major achievement has been to convince people that really accumulating evidence is essential. This was very much Archie Cochrane's message.
For 30 years, Cochrane has fostered a culture of evidence, collaboration and learning that has impacted the work of health researchers, providers and consumers worldwide.
Thank you to everyone in our community for all you have done over the last 30 years. You've helped make Cochrane the leading source of trusted evidence, and that has saved and improved countless lives. We're building on our success to increase equality and diversity so that all people, wherever they are in the world, have access to evidence that will improve their lives.